What's up, guys? Dr. Mo here, digital nomad physician at digitalnomadphysician.com. So I know that setting the price for your virtual medical practice, for your physical medical practice, for your online course, for your health coaching, for your clinical services, for your niche clinical services, all of these can give us a lot of anxiety, and we start thinking, well, isn't this price too high? Isn't this price too low? Am I short selling myself? How do I make that decision? So in this video, I'm going to give you a framework of how I think about setting prices, both for my brand, the Digital Nomad Physician brand, and my Dr. Ashori brand. And these are things that I've done that have worked well for me, but it's also things that I've learned over the years from people who know how to set prices and who are great at marketing. One of the most important things, step one, is to understand your value. This isn't meant for you to be conceited. It's meant for you to understand that right now you're offering a service that actually does not exist in the mainstream healthcare system. The mainstream healthcare system involves somebody having health insurance and then being in network. And then because of their network, they can go to a doctor. And even then, they're going to have a long wait time. They're not really going to know what they're going to get. They might not even get an MD. They might get a PA or an NP, which doesn't mean it's worse or better. It just means that they don't know what they're getting. The time is going to be constrained and limited, and they're probably not going to have much access to that physician after that initial visit in the exam room. So understand that your chances are, if you're offering a private practice, if you're following everything that I've said so far, you're offering a very different service. You are providing a ton of value compared to the baseline of healthcare. And for that, you do get to charge a higher premium because you're offering more value. The next thing to understand or to consider is that your audience matters, right? If you're going after an audience that is focused and worried about fertility, or somebody who wants to have a longer lifespan, or somebody who wants to prevent chronic diseases, or maybe somebody who wants to deal with an aesthetic issue, or versus somebody who's dealing with diabetes management, or somebody who just doesn't want to get their toes amputated. These are very different groups of individuals, and the reason is some people will need to spend money on a healthcare service because if they don't, maybe their life will be in danger or they're going to lose their job. And somebody else might have the option, the elective option, to spend some money on something else, to invest money in their health, to prevent a disease, to become healthier, to perform better, maybe to prevent dementia, or maybe to delay dementia. These are very different types of individuals. These are very different types of groups. And in general, when you sell a vacation home to someone versus when you're just, selling them a small, tiny apartment in the city just so they can be close to their jobs, these people are willing to spend more money, but they're also they might also scrutinize the product a little bit more. So it's important to highlight to them what it is that they're actually getting. So when you actually sit down to set your prices, you got to think about how many hours you're going to be spending just on administration of your business. Now, fortunately for a private medical practice, the admin time is very little. But creating videos like I'm doing right now, right? Talking to your backend support for your website, for your social media, with your CPA, with your attorney, all of these things are bits of time that you have to account for. And the money that you're going to spend on your medical license, on your malpractice insurance, on, for example, I pay $199 a month for Kajabi, and then I pay another $300 a month for my web designer, and I spend another $500 a month for my electronic health record. These are all expenses that I need to build in to this patient cost. On top of that, I got to pay myself a fair wage for what it is that I think I should get rewarded so that I'm motivated to continue showing up to work. 2, that I'm motivated to continue learning and offering more value to them. And 3, so that I can live a sustainable life, so that I can feel like, hey, I can, cover my expenses and support my loved ones. The way pricing usually happens, the way the consumer is comfortable with pricing models, is an hourly charge. Pretty straightforward. You charge $200 an hour, you charge $800 an hour for a much more niche medical service, or you do a package deal where you're saying I'll give you 4 hours for $600, or I give you 3 months for $15,000. And then the third one is a membership model. Think of the direct primary care model or the direct specialty care model, where you're charging a set amount, $150 per month, for a more nebulous amount of care and service and connection time with the physician. These three models, the hourly, the package, and the membership, are well known. People are comfortable with them. But don't forget, within this, you might have other little stuff. You might sell somebody an online course, or you might refer them somewhere where you might get a kickback for that referral. I know, there are laws against certain things, but there are also many ways of doing that in a legal way. For example, getting a certain percentage of something that you're selling the patient, such as a medication. I'm not a big fan of that, so I stay away from that. But in many niche practices, it makes a lot of sense to do that. So now that we kind of covered these topics, don't worry, we're going to wrap them all up nice and beautifully in the end. One of the greatest things that we can offer patients, and it offers them even more value, is price transparency. Having your prices clearly written out. Literally, when you go on a website and it says prices and you click on prices, you go click on some websites and you click on prices and it says give us your information and we'll send you the prices. For me, I don't have a lot of faith in that kind of a company, and usually I leave the page, I bounce, which is called the bounce rate of a client. But if I click on the prices and I see, okay, I know exactly how much I'm going to pay, that's level one. Level two is to know exactly what you're getting for that price. So know that you got to be transparent. You're having your own private virtual medical practice, your private brick and mortar medical practice. They also got to know what is it they're getting. $200 an hour? Does that mean I'll get the whole hour? What if I have to go over? Can I text the doctor afterwards? Can we continue communicating? Can I send him or her my chart? I'm really worried about this chronic fatigue syndrome. I'm really worried about this dermatologic condition that's not controlled. How can I connect with them? So all of that does have to be included for the patient, for there to be true transparency. So we got value. We got your audience that we got to keep in mind. We got the costs that we thought about, and the pricing models, and the communication, the transparency. So how do we put that all together? One way to start is to kind of start backwards. In my ideal medical practice, how many hours a week would I be doing clinical stuff? Look, it's unrealistic that you're going to do 40 hours of clinical time. I mean, if you love what you do, by all means, do 40, do 50. But you need a healthy amount of administrative time in the beginning. And sometimes that might mean that you're charging a little bit more in the beginning, and once things become more streamlined, you can actually lower your prices, or you can offer different price points to different people. So if I need an income of $150,000, $300,000, $500,000 a year based on my expertise, now I'm a family medicine doctor, I know some general stuff about disease prevention, but I'm not an oncologist, I'm not a dermapathologist, so I'm not going to be able to really charge $600,000, $800,000 a year unless I offer something incredibly valuable, right? So you got physicians in the longevity space, you got physicians in lifestyle space. Absolutely, I think the more niche you get, you can offer a lot more money. But figure out what it is that you'd like to start out with. So for me, let's say it's $10,000 a month. I need to now figure out, kind of work backwards, how much admin time do I have? Let's say 30%. How much clinical time will I have? 70%. So if I take these hours and divide it by the number of hours that I work a week, I should have a good sense of how much I need to charge per hour of my time, of my clinical time with the patient, facing the patient, in order to earn that kind of income, whether it's $150 or $200 an hour. That's up to you. Do understand that in a traditional medical practice where a person has insurance, if they have to pay what's called out-of-network fees or cash pay prices, it's usually somewhere between $200 and $400. As a great example, I took my wife to UCLA, sports medicine doctor. She saw Dr. Natif, and the price was $900 for one visit, which did not include the time. And they said, it could be anywhere between 15 to 30 minutes. That's $900 for less than 30 minutes of her time. at UCLA, at a public university. Now, you may not be a Dr. Natif, so of course I understand that, but understand also that in the future you might become that person, and if you continue building your practice in that direction, chances are you will be that voice, that expert voice that a lot of people may want to come to, and that's what you have to spend your time thinking about with your medical practice. In the meantime, set your hours above the baseline of what people are charging. Most urgent cares that you walk into and pay cash are about $200 an hour. Yes, if you're out in the middle of nowhere, it might be a little bit cheaper. Yes, there are minute clinics that are even cheaper than that. But we're talking about access to a physician, urgent care, probably 5 to 7 minutes of actual FaceTime. That's about $200. That's you could put a pin in that. That's actually what people understand. If somebody charges 50, they're like, what are you doing? And if you charge 1,000, they're like, I don't get it. But of course, if your audience is very different, if you got an audience that is very keen, very hyper-focused on value, you can probably charge quite a bit more. If I were to throw out a ballpark, I would say it's quite common for physicians to charge in the private practice model somewhere between $150 to about $1,000. Yes, there are people who are charging way more than that, and there are people who might be charging a little bit less, like maybe in the $70 to $80 per hour range. Wherever you start, it's a good idea to think about how clearly are you defining what it is you're offering the patient. If it's very clear, for me, it's not very clear. Mine is healthy aging. What the hell is healthy aging? What am I getting? I need to back that up with a good amount of social media and social proof in order for the person to understand what it is that they're getting. But fortunately, thanks to other doctors, like Dr. Peter Attia, the longevity space is fairly well defined. So if you go and become a longeviticist, then someone's going to know what it is you're offering, and they have a basic understanding that, okay, Dr. Peter Attia is a concierge doctor. He probably charges somewhere in the neighborhood of $100,000 a year per patient. So if I'm paying, I don't know, $10,000 a month for a longevity doctor, okay, I think that makes sense. And the kind of people that are going into that probably are people who are making several $1,000,000 a year, or making $500,000, $800,000 a year, and they're just really good with their money. Alternatively, you can offer that same version at a lower price point to people who don't have a lot of money and want to still partake in the longevity wave. And same thing with weight loss, by the way. There are very cheap weight loss clinics. And if you decide to create a weight loss clinic specifically for, let's say, mothers postpartum, that's a very niche practice. And because your practice is more focused on these individuals, you can probably charge a little bit more than I don't know how, there's so many of these companies out there, these telehealth companies doing weight loss. And you don't want to really compete with that, because that's what we call a race to the bottom, a race to zero. You want to focus on a niche, and you want to really offer a wonderful service to those people. So that's it for me. If you want to discuss your case in more detail, go to digitalnomadphysician.com. You can hire me 30 minutes for $250, and I'm happy to help you. Take care.